let's turn to the results of the long-term outcomes of patients who received pembrolizumab. This Keytruda is an agent that we have had available in stage 4 non-small cell lung cancer for several years, and it was initially approved by the FDA as a second-line treatment for patients with PD-L1 positive cancer, which is about 2/3 of non-small cell. And Dr. Eddie Guerin presented the results of really about the earliest study with pembrolizumab in previously treated patients mostly, and a minority, about 20%, a little less than 20% of the over 500 patients in that study having not received prior treatment. And what he showed was what appears to be a tail on the curve of very few people who were still doing well at 3 years, falling off that and not doing as well at 4 or 5 years or later. And most of these patients had come off of treatment after 2 years. At the end of all of this, even though this was a population that had received mostly prior treatments, and they had a long-term, it was higher in PD-L1 as we might expect. It was a little better in the patients who got it as a first-line therapy. I would say that these results were overall quite encouraging, but what did you take from that? And do you feel that we might actually be curing some of these patients? And if not, when do you feel comfortable thinking about and talking about the C word here? Ben?
Yeah, I think that these results are encouraging. They're in line with some of the data that my colleague Julie Bramer presented at AACR with single agent Nivo, that the early experience with nivolumab. 15% at 5 years in pretreated patients. Historically, based on SEER analysis, that number is usually 5%. So I think there are a subset of patients that are being cured here. I think the big question to me are, who are these patients? What is in the tumor microenvironment? What are their genetic predispositions? Why are they alive at 5 years versus other patients who don't garner benefit? And I think this, to me, underscores the importance of the hunt for the biomarker to understand why these patients are doing so well. And I think they are long-term outcomes that we're seeing here that are leading to cure. Unfortunately, it's just a percentage of patients. We need to do better, but this is certainly encouraging and a welcome change to what we historically see as about a 5% 5-year survival rate for advanced non-small cell lung cancer.
Charu, what did you take away from that presentation?
Yeah, so, Jack, it's very interesting. So as Ben pointed out, there has been a presentation of data with nivolumab with 5-year survival rates published in JCO and recent presentations at AACR. And if I remember correctly, the 5-year survival rate for those trials came in the teens, I think 16% or so. And, I expected going into ASCO, I expected that we'll see 5-year overall survival rate in the teens. But I actually was very surprised at the remarkable, numbers that we were seeing, upwards of 20%, close to 30% for patients. And I think this is extremely encouraging. I, shared these numbers with first year incoming house staff recently on my inpatient service, and you could just see jaws dropping, especially when you start off by saying, lung cancer, metastatic non-small cell lung cancer is incurable, and they're ready to have the hospice discussion as soon as they walk into a room, and you say, hey guys, let's take a step back and let me share this recent presentation of 5-year survival data, and they're just all blown away. So I think, this is very, encouraging, very intriguing results. I would love to see 7 and 10-year data before I start using the cure word. I do think that there are potential patients who will never need treatment. I think we all have them in our practice. And, it's actually really liberating to see that for these non-targetable mutant patients, they don't have these actionable mutations, but they're just doing so well. It's very endearing and encouraging.
Yeah, I think one of the most encouraging things, well, first of all, whether we should be talking about cure or not, the fact that we are even able to ask the question is something that was hard to even remotely consider a few years ago. Just that we're talking about 5-year survivors is wonderful, and that it's in double digits. So that's great. The numbers are probably better than many of us expected, but just I think that these concepts, along with targeted therapies and what they've been able to do, have really redefined the expectations for a newly diagnosed patient with cancer, where previously, if you were lucky enough to identify a driver mutation, you were off to the races and could realistically think and talk about years of benefit. But for the patients who didn't have an adenocarcinoma, maybe had a more significant smoking history, that was less likely. And now there's a group of patients who can benefit to a similar magnitude who aren't all just the ones with the driver mutation. So the fact that it opens up this potentially huge benefit for a different group than we have been able to serve as well is, I think, great.